Hey guys, Tony Maritato here. Thanks for watching. And today, in just a couple minutes, I'm going to have Max Shippen come and join me. Max is a physical therapist who actually created his own full EMR using Google Sheets and Google Workspace. So I'm really excited to have him. We're going to talk about using Google Sheets as your EMR, some of the advantages, some of the disadvantages, and really just go through a bunch of questions that have been coming in through the Facebook group. So let me see if I can get Max to come on here and join me in just a second. Hey, Max, thank you so much for joining. So I know usually with these kinds of interviews, you do this background and history and tell me about yourself, but the people watching already probably know you, know me. Let's just jump right into the topic. So we're talking about using Google Sheets as an EMR, period, not even an EMR replacement. I would love to know, like, what made you go down that road of thinking, rather than using the off-the-shelf EMRs that are for sale, you wanted to create your own EMR using Google Sheets. What was the reasoning behind that?
Well, cost was the primary reason, and like what the EMRs offer, I found that most of that could be done and if not replaced all on Google Workspace. And I figure I'm already paying for Google Workspace. Why would I pay for it and not use it? So it's kind of why I went down that road.
And help people understand, just because I know, back in the day, we used to use the word Google Suites or G Suites. What are kind of the different levels? Like pretty much everybody has a free Google account. They have Gmail. What's Google Workspace?
Yeah, so Google Workspace is a series of apps that you're able to use that have been created by Google for different things. They have Google Forms where you can put it out and have it as like a quiz or a test. I use the Google Forms for intake sheets. Then you have Google Sheets, which is basically their knockoff of Microsoft Excel. You have Google Docs, which is their Word document processor. And so there's all these different apps that you can use, like Calendar. So Workspace encompasses all of those apps.
What's the general pricing on Google Workspace?
It's anywhere between $6 to $18 per clinician or person that's using it.
Okay. And when you upgrade from a normal Google account to a Workspace account, you can have Google sign a business associates agreement.
That's correct. Yeah. In order to sign the BAA or the business associate agreement, you have to have a paid version of Google Suites or Google Workspace in order to do that. I
Gotcha.
have videos on my YouTube running you exactly through how to sign that BAA as well.
All right, so let's jump into it right now. Like, what are some of the most common questions therapists are coming to you with when they're thinking about using either your EMR system or just they're not in a position in their business where they can afford to buy an off-the-shelf EMR system, or they don't have the volume? Like, why would somebody choose to go the way you're going?
Yeah, absolutely. I mean, it keeps the cost down for one, but there's not much that it's limited in being able to do. So, I mean, a lot of people ask about billing and clearing houses and stuff like that. I think Office Ally has a really nice, workflow. I've watched your videos on it. It doesn't seem too hard to save patients and everything else, but people they want something more simple. And so you can get these things called CSV files that basically are what Office Ally accepts and what they can read from other businesses as well. So you can send a CSV file to Office Ally and you should be able to bill insurance companies through that.
So,
Google Sheets can do that.
okay, and is that the same as an ANSI 837?
I am not sure. I
Okay,
haven't
so
heard
in,
that
in
term
my
before.
software,
Yeah.
which is a super old software, it spits out a text file. It's an ANSI 837. That's the claim file for professional claims. That's what I upload to Office Ally. And then Office Ally takes that and sends it out to the third-party payers for processing. A CSV with a comma separated something
Value. Yep.
value. I assume that's basically the same thing. So you're saying within your system, you can actually generate and export a text file that then gets uploaded directly to a clearinghouse. In this case, we're talking about Office Ally.
Yeah, exactly. I'm working on trying to get the CSV files from other clearinghouses as well, like ClaimMD and stuff like that. Just sent me theirs. I haven't formatted it yet. This is still a work in progress, but it's pretty much 90% of the way there. But the other way that you can do billing is obviously through a CMS 1500. form,
Right.
and this spits out CMS 1500 forms with the grid background or without. So if you have pre-filled templates, you'd be able to do that too.
Which is huge because I know for 20 years that I've been doing this, therapists sometimes are just looking to print a one-off CMS 1500, which for those of you who aren't sure, it's just a claim form. It's the claim form that's universally accepted by all third-party payers. You buy the form pre-printed usually. It's got the red ink background. And then what your system does is it prints the patient information, the claim information on the form so that it's universally accepted by third-party payers. It drives me crazy when I see clinicians, PTs, OTs, SLPs trying to create their own in-house super bill. If they want the best chance of out-of-network reimbursement, just print it on a CMS 1500. But there isn't really a good way to print the CMS 1500. That's why, I'm excited to hear what you have to share. Now, before we get into the actual system, I would love for you to address some of the questions about HIPAA, privacy, compliance. We mentioned the business associates agreement already, but what are some of the things that your system allows to protect the patient privacy, to be HIPAA compliant?
Sure. So in order to be HIPAA compliant, you're not actually supposed to download files to your computer. If you do, you have to encrypt them. And one of the downfalls with Google Workspace is that you have to usually download as a PDF and then upload it again to the Google Drive. What I've done with my system is that it skips that process and it just immediately downloads it to the Google Drive. So then you don't have to worry about downloading these files and forms and then encrypting them onto your computer separately. Obviously, with a BAA, Google Workspace can be HIPAA compliant, but HIPAA compliance all comes down to how you use it, how you're sharing that information, and everything else. So that's really up to your policies that can enable it to stay HIPAA compliant or not.
Wow. And can you give me an idea of some of the size of the practices or providers that are already using your EMR? Because you've had this out for a while now. How long has it been out? And are we talking about only single owner operators that are using it, or are larger multi-provider groups using it? Kind of what's the experience been?
Yeah, that's the nice thing is that this can be updated and you can add as many clinicians as you want. I think it has enough rows that Google limits is 4 million. So technically, I think you could put 4 million clinicians in, but if you have 4 million clinicians, go with a regular EMR. You don't need this. That's not what this is designed for. This is designed for people just starting out and also people with, smallish practices. I've had anywhere from a single solo practitioners, a lot of people who are solo entrepreneurs buy this. And then I've also sold it up to a company that I think had 20 physical therapists.
Wow.
And that's been my largest group that has purchased it so far.
Awesome. Well, listen, you have control of the screen. If you want to jump into it and kind of give us a tour, I'd love to see it.
Sure. There's so much to this. I look back on it and I go, how did I think of that? So there's a lot to this. I doubt that we're going to get to all of it in the time that we have.
Yeah, just give us kind of a general overview of workflow, maybe.
Yeah, workflow. So, I mean, if you're going to be doing a workflow, you can do a patient intake. This is how it streamlines the patient intake. Is that you can click on the intake button here and it pulls up the intake form on the side here. So instead of just having to go onto your own website and fill in an intake form, you can just fill it in on the side of the screen here. This works on any single template. So if you're working on a patient, somebody gives you a call, you can make and schedule right here and add their intake form and complete it. Once the intake form is completed, it creates a patient folder with the patient's name on it, and it then copies and pastes all the templates into that folder as well. Wow. So I've already done that as an example. If we come back here, this is the PT Elite Package 1.8. So this is everything that's included in it. If we come to patients, PT 2023, you can see that it's pre-made max. And you can see there's CMS 1500 forms that I've printed out already. There's subjective consent to treat. And then we get all of the templates that I've made so far that have been copied into it. Now, when you go to document, it's annoying to have to copy and paste all of the stuff over and over again and fill it in. So what you can do here is that as soon as you click on a patient's name, and click on their patient ID, it fills in all the information that you've already filled in below. So there's no need
Gotcha.
to re-enter a lot of stuff. When you use Google Documents, you don't have the ability to import information like you do on Google Sheets. And that's one of the reasons I love Google Sheets. You
Right.
also have
And
the ability to use these buttons as well, which is a unique feature to Google Sheets.
gotcha.
Yeah.
Do you
So
have
with
drop downs for like common diagnoses? Is that something that the user would populate and then they could
yeah,
choose from their own list, or how does that work?
Yeah, so everything is customizable and updatable, right? So if we wanted to do the cervicalgia that I just typed in there, you can see if I start typing cervical, it comes up with diagnoses. If I type in left, it will come up with all of the left hand diagnoses I've already put in. So I've put in about like, I think 100 or so different diagnoses, but if you see one that's not on there and you want to add more, you just come up here to the data center. This is a custom menu I added, data center, and add ICD-10. And then you'd be able to add in your own ICD-10 here if you have one that you don't see that you commonly use. You can also update modifiers for billing. You can also add services. So for, 97161 eval low complexity, you can add more of those if you don't see. So that's how it's able to update and be used by different professions as well.
And is that similar if you need to add a referring physician? There's like an area that you can click the drop down and add your physician.
Yep. So you can
Gotcha.
see right here, add physician, there's bill data entry, subjecting consent to treat. You can do a patient intake form from here as well. So anytime you're documenting on any person, you can do all of these functions.
And if I've got somebody who, let's say I've treated this patient, they're a returning patient 6 months down the road, a year down the road, does it create a new account for that patient with a new patient ID?
Yep. So when you click on the patient intake, you'll be able to fill out a new intake. And the new patient ID is simply their first name and last name initials with the date. So we
Love
come
it.
down here. It's, so for today, it would be MS. What's today's date? 01252023 for my
Gotcha.
patient ID. And that's how I
Awesome.
created unique ID forms for that. And then what you would do is you just click on the patient name and then click on the new ID, and all of their new information would be populated in.
That's incredible.
Yeah, it makes it pretty seamless. Again, you can do everybody always asks about scheduling. Well, you can schedule right from here. If you click on the calendar, your calendar pops out, and then you can also make it so people can schedule from your own website. So for me on my website, you can just click on the schedule button and it opens my availability, and you can see you'd be able to click on one of these treatment slots and the patient can schedule without having to call in. So it's great for people who are returning customers or returning patients.
And so with this, because I've never seen this element, obviously this is all within Google Workspace. This is all covered by the Business Associates Agreement for privacy.
You got it. But
Gotcha.
yeah, the way I know other people were asking about visit tracking here as well. And the way that I've handled that is when you come to the treatment note, progress note, and discharge note, it's all in one. So when you first get it, you're going to get all of these rows expanded. And obviously, we want to make it so it's pretty looking. So you would just minimize some of these forms over here, but it carries forward all of the information from the eval in these blue sections, because that's part of Medicare requirements, is being able to compare eval versus current situation, current status. So you'd be able to update all of your own stuff in the gray areas. And then again, the blue is brought forward from your eval. Now, if we didn't do any posture, you can minimize it here on the left. And this is how you're able to customize each one. If you're just doing a SOAP note, if you're just doing a daily, you can collapse all the row groups and then expand. And then you can see here, we'd be able to type in patient reports increased pain since last RX, right? Keep it simple for right now, but
Sure.
you'd be able to update all of this stuff. Again, you can add more shortcuts for all of these. So you can see I have a shortcut here for this one. If we wanted to add more shortcuts for the objective, we come over to objective shortcuts. As soon as you enter your objective shortcut, it will be available on every single template. It's carried forward to every template, not just this template. So once you use this system and use it more and more, it becomes more efficient and faster for you to do all of your work and documentation.
I mean, that's one of the things that I love about this whole setup is I was just talking to my physical therapist assistant this morning, and I was saying, once we do the first note, the first evaluation, the first anything, all subsequent, all future across all patients should be building on that, what we've already created and improving it, not recreating it every single time. And that's basically what you're getting the benefits of an artificial intelligence with human intelligence.
Absolutely.
That's awesome. So what does something like this look like when, okay, I've completed it. Now I need to integrate with a fax system, or how do I get this information out to the physician or whoever's going to need it?
Yeah. So what you would do is that you would save it as a PDF. So if I come here, you can also see one of the requirements for Medicare too is that you have to count up all of the numbers per code that you're using. So once you start adding more flow sheets, so in the shortcut flow sheet, once you add more and more of these, you'd be able to select any of your exercises, and you can see that it adds it up, and then it automatically adds the time below here as well. But once you're ready to sign, I click this box. You can see that it is now has my signature. I can put in the date, and then I click on Save as PDF. And what it does is it saves the patient name, it saves the current tab that I'm on, and then it saves it with the date and time. It creates this link so you can review it. And this is what it will look like.
And you're reviewing it right now, still within the Google Drive.
Correct. It has not left Google Drive. It has stayed on my Google Drive. I have not downloaded it at all to my computer. It's in my cache technically, but that's still online. So that's reviewing it. And then if we needed to fax it out, you can come up here to the PDFs inside of the patient folder, and then you can see this is the one that we just saved. And again, we can review it here, and then we'd be able to fax it. I use SR Fax, which I can upload directly from my Google Drive as well. They make it really easy to do. I know another people asked, how would you keep track of that stuff? So if we come over here to the data center, we can see visit tracking. So what we can do here is that I can verify that I sent it out, or I can, send to MD and I can type in the date that I sent it. Any of this can be customized, right? This is just a Google sheet, so that's the beauty of it, is that you don't need me, you don't need any programmer to customize something or fix something. If you see something you don't like, change it and it's done. You can make it how you need for your own business. But again, able to, if I was going to do an addendum so that it's not on the patient tracker, I would fix it there, because you can see as I save, it's going to add more visits that have been used. But I guess let me backtrack a little bit. Before I would want to save as PDF, I'm going to copy and name it, because now I can name it, as you can see, RX1 is already there. So I'll name it as RX2. And then that way, if I needed to come back and make an addendum, I would just do copy and name to the current sheet, because what it does is it copies everything on the sheet. So I can copy and name it RX2 addendum. And then I'd be able to file and save and say see addendum. And then that way it's going to keep track of the correct amount of units for visits used. And again, it calculates it for you, but you can just type in your own number. If you're like, oh, that was the third visit, just type in 3. So it does automation, but it's only so smart.
And so I know we've already overwhelmed like 98% of the people watching this. But just so I'm clear, because I think I understand, when you're inside a patient account, a patient record, as you're creating these treatment notes, let's say it's actually generating tabs down at the bottom.
Correct.
So each of those tabs, you can kind of scroll through, go back, just like you would any medical record. Or we still, we're in the Stone Ages at my clinic, and we use paper charts for a lot of stuff. And I can literally flip a page. That's essentially what you're doing here.
Yeah. So, I mean, if you're going to the first treatment, I can click here and look, oh, yep, this is what we did on the first treatment. These are the exercises we did. Okay. All right, here's the second treatment. oh, they were hurt after that first treatment, let's change things around. So it makes it really easy to just review it and then go on to the current note. If you write your current note and then copy and name, all of the information from this visit will be here, so you can review it without having to go back to those tabs too. And then you just write your most current stuff, copy and name RX3, and now you have your newest treatment. And that's
Wow.
how I've been doing it.
Well, let me ask you this, because I know you have a hard stop in about 8 minutes. Is there any other elements? I mean, obviously there's more to this. We haven't even touched on the billing side of things and CMS 1500 generation, that stuff. Before I ask you some last questions, is there anything else that you really want people to get a chance to see within what you have so far?
Sure. Wait, there's more, right?
Yeah.
So I actually made a home exercise program as well. So
Oh,
as you start to add more of your own exercises to the flow sheet, you can select on all of those exercises and you'll be able to make your own home exercise program. So this way you can add links to the instructions. If you have YouTube channel, you can have them follow along your directions exactly right there. You can send this out as a PDF to your patients so they'd be able to click on those links and follow it directly to your videos. But the other thing too is that I know not everybody speaks English, so you can have a source language as English and we can translate it into Spanish. There's about, I think, 30 or different languages here. If anybody speaks Polish, please let me know if this is correct.
wow.
But you can translate it immediately and then save as PDF. So this is just an example of the home exercise program. Real quick, if we want to make a CMS with a grid, we would click on the button here. And then it's going to do its thing. It again creates a folder or a file for you to review. And you can see all the information is filled in here for what we want to bill, and it's all done.
That's awesome.
Yep. And again, it saves directly to it, so you aren't saving it to your computer at all. Saving without a grid, we would click this. And then you can see that it saves without a grid, and it's going to print directly onto your pre-made forms, however you need it. But yeah, it's super. Once you get to use it, just like any system, it works really well when you
Right.
know it. You know, I built this thing from the ground up so I can fly through it and do everything I need to relatively quickly. But there is so much more that I want to do with this. I want to make it a real competitor with any EMR out there.
Yeah.
And I want to add like how people are doing. I want to add graphs to how much employees are billing, how much they're doing, how many people they're seeing. I want to add all these things to really make it very functional as well as business friendly for
Do me a
business
favor,
owners.
unshare your screen for just a sec.
Sure.
And with that, so let me ask you, because I know people have the same questions that I'm thinking. Okay, so they buy it, they buy into this. How do they learn how to use it?
Yeah, so I have a YouTube channel where I teach people how to use it. So any question you have, I'll make a new video for it. As you can see, I've started doing video tutorials down on the bottom of that screen. I'm not sharing anymore. Hold on. So you can see I've started adding more to the bottom of the screen over here onto the left. So as I'm adding more, it will be updated for that. But I'm also very friendly. If people have questions and they do buy it from me, I'm more than happy to go through the setup with you, more than happy to run you through general how to use it. I also created a PDF of how to use every single tab and how to go through it all and what errors will look like. But again, if you can't figure it out, just shoot me a text or, give me a buzz. I'm more than happy to help you out.
And last question before I ask how people find out about it, purchase it, connect with you. In your own words, kind of who is the ideal user for a system like this? I always say, like, there is no perfect EMR for everybody. There's going to be EMRs that work for you right now, but maybe not work for you in the future. It's so dependent on the individual situation. But from your experience and the people that that have been using it, kind of who's the ideal candidate for a system like this?
Yeah, I mean, it's people who want to cut their expenses and who want to have a functional documentation system that you can use. so solo practitioners, small clinics. I had one clinic buy it and they said, you cut our cost so much from our EMR that we were able to keep people employed, and so like, I'm just so grateful for this experience, even just for helping that one clinic out. I'm more than happy
Sure.
to, if I never sold another one of these, I'd be happy, just knowing that I helped people save their jobs and keep people employed has been a really cool opportunity. But definitely these smaller practitioners, I don't think it would do well with a lot of people on it.
Yeah. And so I know you have a Facebook group. What's the name of the Facebook group?
It's Google Workspace for documentation and as an EMR by unsubscribed healthcare.
I'm glad you went with a short, quick name.
Yeah, easy to remember.
Yeah. Well, it's like mine, the group name is so long. What's the name of the website?
www.unsubscribed.healthcare.
And help us understand what does unsubscribed healthcare mean?
I hate that you don't own anything, right? You don't own anything anymore. You're always, subscribing to a service, whether or not you're leasing your car, whether or not you're subscribing to something. And then you, at the end of it, what do you have to show, right? So I'm trying to give somebody something back, and I hope to expand this to more than just healthcare. I want to do a whole technology field where it's just you buy it one time and then you're good. You don't have to pay again. Obviously for healthcare, it's a little bit different because you have that monthly subscription to Google, but if I can unsubscribe you from a lot of your stuff, that's kind of my goal with this business. And that's why I went with like unsubscribed.
That's awesome. I mean, I think you took a kernel of idea and grew it into like a huge crop. I think this is such a needed resource for the profession. And I know that PT can use it, OT can use it, SLP can use it. I mean, it's gonna grow. Max, I want to be respectful of your time. I know we have to wrap up. Thank you so much for being here. I'll put all of your contact information in the description of the video. I'll get this out. And if people want to reach out, what's the best way for them to do it?
Yeah, if you want to email me, that would be best. I'm easier to track that way if you send me an email. So it's max@unsubscribed.healthcare.
Awesome. I'll put that down below. Max, thank you so much for your time.
All right. Thank you so much, Tony. This was great.
All right, guys. So that was incredible. Like, truthfully, I knew Max had been working on that project. I knew it had been growing. I had no idea the extent to which it had grown. I truly believe, like, I love off-the-shelf EMRs. I think they have a purpose. I'm fond of Hello Note and other EMRs that are out there for the right organization. But what I find is lacking in a large commercial EMR is absolutely what Max has in this Google Sheets-based EMR. The versatility, being able to create your own templates, creating a marketplace where if I create documentation templates that you might want, you would be able to reach out, purchase those templates from me. I can, repurpose the work that I put into my own practice development and make it available to other clinicians. I think a secondary market is coming. I know it's been alluded to, but it hasn't been announced yet. So if you want information, don't hesitate to reach out to Max. We've known each other for probably close to a year now, and it's just been a great relationship. Otherwise, thanks so much for watching, and I hope you find the solutions you're looking for.